Baylor is unique in having a large number of specialized hematologist oncologists. Those are doctors which take care of blood cancers, leukemia, lymphoma, and multiple myeloma. They're rare. They occur in 1 in 100,000 patients.
Blood cancers are usually detected when somebody goes into their doctor not feeling quite right, and we see an abnormality usually in their blood counts.
If we see abnormal cells and we think this is leukemia, then this is going to precipitate a full workup on these individuals. And this has become very, very important because they determine prognosis for these individuals, as well as there are also various therapeutic modalities that can be offered.
As long as we can do better, we need to advance our standard of care, and we are focusing on a lot of research studies here in acute leukemia.
Every case is unique. We try to find the common threads and treat them with the medicines that can be used for everybody, but we also try to find those little genetic unique features which let us add something special to the treatment to increase the chance of cure. And that's been a real revelation in our field.
I think that this is an incredible time to be an oncologist. Our understanding of AML, our understanding of what are important prognostic factors and unique pathways of the disease have led to new treatments for acute leukemia. I mean, everything from adoptive immunotherapy to new transplant approaches to small molecule inhibitors of critical pathways for disease to antibody drug conjugates. I mean, just so many new ways of treating leukemia that are so different than care that we've had for the past 30 years.
In an era where there's a new drug coming out almost every month by the FDA, you have to stay on top of the game, and the game is changing very quickly. There are pills to treat leukemia. There are new immunologic therapies which stimulate your immune system to kill the cancer. They're a complete change in the paradigm in which cancer is being treated. And the group of doctors we have here, all of them are academic and are up on the treatments that are available.
Our treatment of cancer, and this is all cancers, is not where we want it to be. So until we're able to cure cancers, all cancers at 100%, and have toxicities be minimal to none, then we can do better. And the only way we get better is to do something different than what we're currently doing. And that is through clinical trials. So clinical trials let us know whether or not our treatments are better than what we're currently doing.
In the past, when people were diagnosed with acute leukemia, their survival was months, maybe a year, and now with the availability of these clinical trials and newer drugs that are available. Plus, another thing that we can support them with here, we have a very active bone marrow transplant unit. So some of these individuals can initially be treated with maybe chemotherapy drugs, and then they move on to transplantation. So I think that's a plus when you have these availability right within the same center.
Science is getting more sophisticated. Drug companies are inventing molecules that stimulate your own immune system. And so the research is beginning to try to use your own immune cells rather than take someone else's and flip the on switch on your immune cells to get them to attack the cancer.
The type of treatment that people are most excited about now is an adoptive immunotherapy approach called CAR-T, which stands for chimeric antigen receptor modified T cells. And that's a fancy way of saying that we train the T cells, a type of white blood cell that's in the body, to seek out a surface marker that's expressed on these cancer cells. And they basically sniff it out wherever it is in the body and kill it. And we've seen some remarkable responses in a variety of blood cancers. And the hope is that a lot of these will be durable, meaning cures.
Given the sheer numbers of cancer cells, given that cancer cells have the ability to mutate and change over time, it's remarkable that we can cure cancer at all. The key is to use multiple different points of attack continually and persistently going after the cancer cell.
The amount of people that we're curing is actually increasing. It's impressive. The knowledge seems to be growing exponentially. The many different approaches that we have at attacking cancer cells is also, it seems to be growing exponentially. Just a great time to be in oncology.